Over to you, Stacy.
Great. Yes. Thank you. Thank you, Sybil, for inviting me today. My name is Stacy Dawes, and I'm the Health and Community Engagement Lead at Family Caregivers of BC. Today, I'm going to be sharing information about our Caregiver RX program within our organization, and it highlights the importance of caregiver, unpaid family caregiver identification and support and referral to community-based organizations. I'd like to begin to acknowledge the land on which I live and work. I'm deeply grateful to reside on the traditional unceded territories of the Coquitlam, Musqueam, Squamish, Stilo, and Tsleil-Waututh First Nations. I honor their enduring stewardship and protection of the land and the water and appreciate their generosity of spirit with which they have shared their teachings. I'd also like to recognize the Lewencan people, known today as the Sanis and Esquimalt First Nations, whose leadership and care and connection to the land shaped the region known today as Victoria, and that's where our main office is located. So who are we? Who are Family Caregivers of BC? Our mission is simple but powerful. So we support the people who support others. We've been doing this work since 1989, very grassroots organization starting in Victoria, walking alongside caregivers. We're listening to their needs and creating pathways to resources and connection and hope. So it's with the support of the BC Ministry of Health, the Canadian Centre of Caregiving Excellence, and the Petro-Canada Caremakers Foundation, so where some of you may get your gas. We serve caregivers in every corner of the province or provincial organization. Our work is grounded in 3 pillars: caregiver support, so direct caregiver support, education and information, and system change through collaborations and engagements. And we're here to make caregiving more visible, more valued, and better supported. So these are our 3 pillars here, with a little bit more in depth on what kind of falls into 3 of those pillars. So through our caregiver support, you can access our Monday through Friday caregiver support line. We also have one-to-one caregiver coaching and virtual support groups and in-person support groups in the Victoria area. We have a robust resource library on our website called the Caregiver Learning Center, where you can access recorded webinars. We have podcasts, supportive tip sheets and workbooks. And through our collaborations, we work with policymakers, frontline healthcare providers, and community organization staff to create partnerships for caregiving identification and awareness. We work within social prescribing, and we're building a caregiver-friendly healthcare system where caregivers are seen and included as partners in care. So this slide showcases the 6 provincial caregiver organizations currently serving communities across Canada. So while we operate within different healthcare systems and have different funders, we're all united by this common purpose to directly support unpaid caregivers and raise this awareness of their role within the healthcare system. So each organization tailors its programs to meet the local needs, like offering services like emotional support, system navigation, education, advocacy, and peer connection. So our delivery models may vary, but we're aligned in recognizing that caregivers are essential members of the care team. So together we are also driving national awareness and pushing for policy change at a federal level and sharing solutions that improve the caregiver experience from province to province. One of the biggest challenges and barriers that we're seeing to caregiver support is that most caregivers don't actually see themselves as caregivers. So that could be quite a challenge to providing that support early in their role. They see themselves as the relationship that they have with the person that they're caring for. So they could be a spouse, a son, a friend, helping somebody that they love. So their focus is almost always on the person receiving care and not themselves, which means they often don't ask for that help and support until they're in a crisis situation. So it's at CCBC, we're trying to shift that culture. We're trying to start identifying caregivers early and offering them support before they burn out. Caregivers are experiencing chronic health conditions at twice the rate of the general population. So it's even with their deep commitment, many caregivers feel their efforts are often being taken for granted by other family members, the broader system, and sometimes even by the person that's receiving the care. This leaves them feeling unseen and alone in the responsibilities that they carry every day, often having to advocate for themselves and not only for their loved one, advocating for their loved one, but also for their own need for support and recognition. So when we do take a closer look, the challenges that caregivers face are significant and very multi-layered. They're juggling overwhelming responsibilities and often navigating the healthcare system alone. There's the financial strain, the emotional distress, and the social isolation are quite common within caregivers. And on top of that, the family dynamics can complicate even further. So these challenges don't just impact the caregiver, they directly affect the care recipient's outcomes and the system level efficiency. The good news is that once a caregiver is identified and referred to us, there are many ways that we can support them, but that's the first step, is the recognition and the referral. It's critical. So that's where you come in. This is where healthcare providers, you're often the first point of contact with the caregiver. So it's a simple early referral can make all the difference for our caregivers' emotional and mental well-being and physical well-being. So understanding our Caregiver RX. Under our Caregiver RX program, there's different levels of engagement. The very first, the one that we're actively working on is our social prescribing. So we're at a time currently where isolation and mental health concerns, they're posing legitimate health risks for our communities. There continues to be this universal need to prioritize people's overall well-being. So family caregivers can find themselves at even a greater risk because of the known challenges that accompany their role. Our Caregiver RX social prescribing includes a wraparound support model where we address a caregiver's social determinants of health, and we co-create a personalized care plan over a series of meetings. We support family and friend caregivers of all ages who are supporting someone living with a disease, a disability, mental health condition, or frailty due to aging. And all of our services as well, I didn't mention this, are free. So there's no charge to receive any of our supports. Our Caregiver RX program isn't about just referrals. It's about delivering meaningful outcomes that strengthen caregivers and the systems around them. So the 4 core objectives that guide our work are resilience building and enhanced well-being. So we aim to reduce that caregiver burnout and isolation by offering proactive, personalized support. So this includes physical, emotional, social, intellectual, and even spiritual well-being, because caregiving touches every part of a person's life. We've heard from caregivers that even just one supportive call can be a lifeline for them. Then there's social connectedness. So many caregivers say they feel invisible. This model creates space for them to be seen, to be heard, and to be supported. So it's through our peer groups, our peer support groups, and our workshops and our connections to local supports as well that caregivers feel less alone and more connected to the community. So it's that sense of belonging that matters, especially for those that are caring for a loved one at home. Then there's empowerment and agency. So navigating our healthcare system is complex and it's tough. So we add in that emotional overwhelm and lack of time, and many caregivers give up before they can get help. So our navigators and our caregiver support team can help equip caregivers with the knowledge and the tools to advocate both for themselves and for the person that they're caring for, their care partners. And then there's this decreased reliance on health services. When caregivers are well supported, they're more likely to manage at home. They delay crises and they avoid the unnecessary hospital visits. So this doesn't just benefit the caregiver, the person that's caring for the care recipient, but it improves those outcomes for the entire care team and the health system. So taking together all of these objectives, it shifts caregiving from being an unseen burden or stress to a recognized part of the care plan. So it's a win for caregivers, it's a win for providers, and it's a win for the overall system. So this is how the model works in practice. It starts by the identification by a healthcare provider, followed by a referral to FCBC and our team, our caregiver support team. A caregiver navigator will connect with the caregiver within 3 business days, helps them build a personalized support plan, and we follow up to assess outcomes and improve our support. It's simple and it's scalable and effective, and it's already being used by multiple clinics and community partners across BC. We build flexible pathways so providers like yourself can refer caregivers in a way that fits you and that works best for you. We have the availability for referrals through pathways, so system integrated tools, EMR order sets. We also have a simple online referral form for direct referral, or the paper-based options like our Caregiver RX prescription pad, will you see right on the right there of the screen. So it's whether you have 2 minutes or 10 seconds, there's a way to connect a caregiver that you interact with for further support. Once a caregiver is referred, our caregiver navigator becomes their central guide. So they complete the standardized intake, they co-create a care plan and provide system navigation and connect the caregivers also to community resources. So local resources, if they may want to access any sort of support groups or peer support groups, we're able to refer them and connect them to community-based organizations. So beyond navigation, at CBC, we offer a range of direct support services to meet a caregiver, to meet them where they're at. So it's our caregiver support line that I mentioned. We're available Monday through Friday, offering free emotional support and guidance to caregivers. For more complex situations, caregivers can be matched with a coach to receive in-depth personalized support and develop a robust caregiver action plan. And we also offer a range of caregiver and healthcare provider education resources, including help sheets and flip books, webinars, blog posts, and our podcast. And it's through our newsletters and social media, we're building this awareness and we're fostering community. We're to strengthen local support as well, our community partners. We provide online training for staff and volunteers in community organizations, so caregiver support facilitator training. So we're equipping them to facilitate caregiver support groups and grow caregiver programs across the province, as well as hosting monthly community practices for caregiver facilitators to come together and network and share. Our Caregiver RX social prescribing program, it's working. So more healthcare providers are identifying caregivers through their interactions. And because of this, referrals to FCBC from healthcare professionals have increased by 131% since our launch in 2017. And 45% of our caregiver calls that we receive are through direct referrals from healthcare providers. So now that we've talked about the Caregiver RX program as direct support for caregivers, I'd like to shift to how we can strengthen caregiver inclusion within the healthcare system itself. When we say caregiver-friendly healthcare, we're referring to a system where family and friend caregivers feel truly seen, where they're valued and included as partners in care. But for that to happen, we need systems, we need structures and processes that can make caregivers visible and integrate their role into the care team. That's what caregiver-friendly healthcare is all about. So how do we get there? I know it's easy to say, but even more difficult to do. So at Family Caregivers of BC, our approach is to building caregiver-friendly healthcare as three parts, where we work with health partners to integrate caregiver identification and referrals and inclusion directly into those care practices. And that includes things like adding a caregiver contact to the EMR or using tools like our Caregiver RX to refer them for support. We're also building relationships, so we collaborate on all levels, from frontline teams to health authority leadership, to ensure that caregiver support is integrated into system design and practice. And we're striving for policy change. So ultimately, we want to influence the broader system, whether it's through data, pilot projects, provincial or national strategy. We aim to make caregiver inclusion a standard, not a side note. So this three-part approach is how we move from the one-off support to this lasting change. And we're seeing growing momentum across BC to make this a reality. So let's begin with the foundation, the triad of care model. This framework highlights the essential roles of the patient, the provider, and the caregiver. So all working together to create a comprehensive coordinated care. So as providers, you bring clinical expertise. Patients contribute their lived experiences and preferences, and caregivers, often family members or friends or close friends, they're bringing the critical understanding of the day-to-day needs, the routines, and the changes. So when all three perspectives are integrated, we get holistic care and better shared decision-making and greater consistency across care settings, especially during transitions. But why does caregiver inclusion matter so much? So first, because caregiving is incredibly common, so 42% of Canadians over 15 years of age are unpaid caregivers, their contribution isn't just personal, it's systematic. In fact, unpaid caregiving is valued at over 97 billion annually in Canada. So however, this contribution often comes at a personal cost. More than half of caregivers report that they're feeling tired or anxious, and yet they're often visible in some formal care settings. Many aren't recognized as these care partners, and they face gaps in support and access and communication. When we actively include caregivers, everyone benefits. So patients do better because caregivers provide context, monitor changes, and reinforce care plans. Communication improves. Caregivers are helping to reduce misunderstandings between healthcare providers and families, and caregivers themselves are supported, which reduces burnout, improves their well-being, and strengthens their ability to continue in their role. So the takeaway, caregivers aren't just a support system, they are part of the care team. And when we acknowledge and include them, we enhance the care for everyone involved. Now that we've talked about why caregiver inclusion matters, both for the patient outcomes and system effectiveness, let's shift to the how. How can you, as healthcare providers, meaningfully support and refer caregivers in your day-to-day practice? So we've developed a full suite of tools designed specifically for healthcare professionals to help identify and refer and support caregivers more easily. We have a dedicated referral landing page on our FCBC website tailored for providers, and the resources include things like referral forms, paper forms, and online referral forms, consent forms, those prescription tear-off pads for caregiver self-referral. We have brochures and rack cards and educational webinars and toolkits. And everything is co-designed to fit naturally into your existing workflows, and more importantly, to connect caregivers with that timely, direct support. And ordering is simple. So by scanning this QR code, you can access our online order form. So once submitted, we'll ship everything directly to your clinic or organization free of charge. And this includes all print materials, RX pads, and more. So it's designed to remove as many barriers as possible to get these tools into your hands. And if you'd like to learn more or book a quick presentation for your team or talk through what referral can look like in your setting, please feel free to reach out and connect with myself. I'm happy to connect one-on-one or support you in getting started. And you could also refer directly, as I mentioned, through our healthcare provider resource page. Thank you for your time and your commitment in improving caregiver inclusion in our healthcare system.